Welcome to this beautiful Friday, to our meetup with health and education professionals. Thank you for those who sent through your apologies that you couldn't make it, no dramas. I know some were looking forward to coming to our in-person meetup at the North Lakes Hotel at 2:30 next Friday. I've actually booked to go to a conference at the last minute, so I won't be here. So we won't have the online or the in-person get-together next Friday, but we'll have the weekly get-togethers online from the Friday after that. And each month we will be having the in-person get-togethers, just we couldn't make it for the next one. So look forward to seeing you guys then. And hopefully you can get your hands on my new book, Empowering Parents. Very good resource for parents and carers, I hope. So today I thought a good topic for us to tackle is actually how do we collaborate as health and education professionals to get the maximum positive outcomes for young people, because there is not a lot of collaboration between our sectors, which means there's not a lot of innovation, which means that we are really dealing ourselves the hard end of the stick, because there are some barriers there. And I know there's some good stuff starting to happen. It would be great to capitalize on some of that and make the most of it. So I thought it would be good for us to have a look at that today. So I will just share my screen, a little bit of information on that. So let's dive into it. So as you can imagine, there are a number of barriers that kind of get in the way of the education health systems collaborating, not working very closely together to promote those positive outcomes. Some of those tie into things, as you can imagine, like having separate administrative structures. So we know that the health and education systems, they operate under different administration structures that can make coordination and collaboration very challenging. So each system has its own set of priorities, funding mechanisms, reporting requirements, and that can create a barrier to seamless integration. So we need to start to have a think about, okay, what can we do about these structures to try and enhance positive health outcomes for young people? We want to have that interagency collaboration, information sharing between health and education agencies at various levels, national, state, local. We want to establish formal mechanisms for communication and coordination. So some interagency task forces or working groups focused on specific health issues affecting young people. We know things like depression and anxiety is huge. We know there's a huge rate, particularly in young teen males and young adult males, around suicide, and this stuff needs to be addressed. And the way that we could do that is through a collaborative model. We can have more integrated service delivery models. So where we bring together the health and education services in one location through coordinated partnerships. I know there's a little bit of trial work and some pilots going on, for example, at Redcliffe High School around that. It is so small, it's not very well rolled out. So it would be, and people don't know about it. So I think it would be really good to look at that on a broader scale. Then professional development and training. We can actually have opportunities for healthcare providers and educators to receive joint professional development and training. Why do we need to do it separately? I was in the city and I saw there was the Principals Association. They were having a conference. Wouldn't it be amazing if we also had the healthcare professionals and the teachers there all collaborating together? That would be amazing. Then we can get a shared understanding of each other's roles and enhance our ability to collaborate effectively. We could have workshops and conferences and interdisciplinary training programs that facilitate this. So I'm going to a conference for occupational therapists coming up. That's why I can't make it to the in-person meeting. Wouldn't it be amazing if we opened it up to broader cross-sector collaboration, including the education sector, and getting all those minds together would be amazing. Then we've got to think about our data sharing and information systems, integrating that a little bit more. What mechanisms can we have that's going to be secure and have that responsible sharing of data between the health and education sectors? Interoperable information systems or data sharing arrangements. Obviously, we've got to take into account, privacy, and we'll get to that shortly. But yeah, we want to be able to exchange the necessary information whilst ensuring that privacy protection is upheld. We need to have a look at policy alignment and coordination. promoting coordination between the health and education sectors at that government level, developing joint policies, frameworks, guidelines with shared outcomes and goals, expectations on young people's health outcomes. So strengthening that cross-sectoral governance structures. We know that the state government wants to focus on promoting health and wellbeing. We know that the state and federal governments are keen on innovations. To innovate, we have to collaborate. That's why our meetup is here. So these are some ways that we can do it. We need to have a look at our funding and resource allocation. So, dedicating funding streams that support collaborative initiatives between the health and education sectors. That's going to help with overcoming those resource constraints and enable the development of some joint programs and services and interventions targeting young people's health and education needs. We know that if we're not feeling particularly good, we're not going to learn very well. So we know that if we can enhance health outcomes, we're going to enhance learning outcomes, which is fantastic and benefit the society as well. We want to have a look at those community engagement and partnerships, getting the community organisations, parents and students involved in the process of working out how do we want to improve those health outcomes for us. Those partnerships between the schools, healthcare providers, local area coordination, organisations and stakeholders to enhance that availability and accessibility of the health promoting resources and services. And we want to have a look at our, doing some research and looking at some evidence-based practices, encouraging research that explores that intersection between health and education and evaluates the effectiveness of collaborative approaches. We want to promote the dissemination and adoption of evidence-based practices and interventions that have got those demonstrated positive outcomes for young people's health and their educational achievement as well. So that's one important one. Another barrier can be around, different professional expertise. So we know that, the people in the education sector and people in the health sector, we have different expertise, which is fine. We don't always have those opportunities for interdisciplinary collaboration. Educators, they're focusing on that academic development and pedagogy. Health professionals are trained more on maybe diagnosing or treating health conditions and illnesses. And we want to bridge the gap between those two domains because it does require dedicated effort and resources. So, okay, how are we going to do that? We need some strategies to collaborate. It's going to be really important moving forward if we want to innovate in the health and education space. We've talked a little bit around in terms of collaborating. We can have a look at those interdisciplinary trainings that we talked about earlier, collaborative planning and goal setting, so involving both the health and education sectors in those, so the joint meetings, discussions, forums where they can come together and identify common objectives and develop really integrated strategies. Integrated curriculum and cross-sectoral learning. So we can embed health education and wellness topics into the curriculum and teaching practices. We can provide opportunities for students to learn about their physical, mental health, develop the life skills, and engage in activities that promote wellbeing. It's a really big passion I have. I would love to bring all of the things that we teach our clients into the schools. Let's teach it to everybody. We try and teach things that everyone can benefit from. So let's embed it into the curriculum. Let's teach people how to do their tax returns. Let's teach people how to have positive relationships, how to choose a good long-term partner, how to sort of take care of themselves and look after their body, their biggest asset. That's a little passion of mine in case you can't tell. So we can have a look at the coordinated support teams and coordinated referral systems, that consists of both professionals from health and the education backgrounds, school nurses, counsellors, psychologists, social workers, occupational therapists, teachers, working together to identify and address the health needs of young people. So we need to have those really clear referral pathways between schools and healthcare providers to ensure a seamless transfer of that care when those more, targeted services are needed. And the joint interventions and programs. We want the expertise of both the health and education professionals. So it might be that we're targeting mental health promotion, healthy lifestyle choices, substance abuse prevention, sexual health education, working together and creating those comprehensive and evidence-based interventions that address the diverse needs of young people. We want to encourage those shared resources and knowledge and exchanging those. So, exchanging research findings, best practices between the two sectors, having platforms where we can exchange knowledge and collaborate on those research projects and to share successful initiatives. We want to enhance cross-sectoral learning, encourage innovation, and promote the adoption of evidence-based approaches. And finally, we really want to develop our teamwork between the sectors and our communication skills development between the sectors, promoting effective problem solving, communication, mutual respect, and make sure we've got those training programs and workshops focused on building these skills to improve our interdisciplinary collaboration and enhance the ability to work together for those positive health outcomes. So one of the other barriers is this issue of limited resources and competing priorities. So we've got those resource constraints that mean that sometimes we feel like we're competing for resources. So we really need to have a look at some strategies to address that as well. So, of course, it's got to come down to the advocacy and the reform level. I went to Toastmasters the other day, and one of the people gave a speech about, how we have issues come up that get the government's attention, and generally the issues that get the government's attention are crises that seem to affect the majority, and then there's this sort of issues cycle that goes on. It's really fascinating. It was a really interesting little presentation. So we need to get it in the government's attention. The importance of it. It is a crisis. Look at the high divorce rate. Look at the high issues of mental health issues. It is a crisis, and we need to that needs to be addressed in that way. So we want to have increased funding for the resources for both the health and education sectors, improving those healthy outcomes for young people. We want to be engaging with the policymakers, the community leaders, stakeholders to raise the awareness about the importance of investing in youth health. Lobbying for policy reforms that prioritise collaboration and allocate resources strategically. With those resources, we're going to collaboratively identify shared priorities and allocate them accordingly. We want to have dialogue and negotiation between the health and education sectors to have those aligned objectives and then pull the resources towards those common goals together. We're going to achieve more together. It's like that little saying, 1 + 1 doesn't equal 2. When we work together, 1 + 1 = 3. We can make more with the resources that we have. We might need to reallocate some existing resources. We might need to seek additional funding resources. We might need to explore some innovative financing models. And we need to, do that between agencies, that resource sharing, identify those opportunities for joint initiatives, programs, services that leverage the strengths of both sectors. Again, we want to make sure that we have that evidence-based resource allocation. So we want to allocate resources based on demonstrated effectiveness, investing in programs and interventions that have been proven to provide positive outcomes for young people's health, rigorously evaluating and monitoring if it's working. That's really important as well. We want to get that best return on investment. And that collaboration with community organisations, stakeholders, as we've talked about before, fostering those partnerships, streamlined administrative services. There could be some duplicated or inefficient ways that it's working at the moment. If we streamline it, we can reduce the bureaucracy, we can improve the coordination, and free up some more resources that way to be more efficient and effective in terms of funding. We might seek out and apply for grants and funding opportunities that specific target health and education collaborations. There are organisations and foundations out there that offer grants to support initiatives to bridge the gaps between sectors. So being able to identify and particular funding resources that could support joint programs and interventions would be a good way as well. And we want to promote those private-public partnerships. We can explore it between organisations, businesses, philanthropic entities, any of those that have an interest in promoting youth health outcomes, in terms of maybe providing some additional financial resources, expertise, and support just to address those resource constraints. And again, we want to have that outcome-focused planning and evaluation to make sure that the priorities are being addressed and it is working effectively. Then we have the big one, privacy and consent concerns. Now, this is the big one that I come up against with, our health practice, commonly told by schools. We've been advised by our lawyers that you can't come in, and if you did come in, we'd need consent of all the parents. And it seems to be becoming increasingly a roadblock. And in my way of thinking, we've got a couple of moral and legal dilemmas going on here. We've got the legal around consents, which I don't think is too hard to work around personally. And then we've got the one around, if we don't provide this service, what is going to happen to these people? When I go into schools, I see a kid sitting by themselves, not playing with anyone, not knowing how to interact, other kids not knowing how to interact with them. And I know we can sort that out. And if we can get in there and we do what we can outside of the schools, but this, when you're alone, you've got a higher chance of being bullied. When you get bullied, you've got a higher chance of mental health issues. They often can stick with you later on in life. All of these things can be preventable. So it's a bit of a passion of mine. So let's think, how can we address these privacy and consent concerns that come up? We want to have clear guidelines and policies that outline how the health and education professionals can appropriately handle that sensitive health information whilst ensuring privacy, protection, and consent. So addressing the data sharing, consent requirements, the confidentiality, let's troubleshoot it, let's problem solve it, and make sure that we've got the training on those policies as well. We want to raise awareness amongst professionals, students, parents, and guardians about privacy and consent issues in the context of health and education, around the importance of those laws and regulations about, data sharing and rights and their options available as well. So if they want to opt out, they can, and if they want to opt in, they can, and we make that really easy for them. So we're promoting that transparency and open communication. So we are making sure that we build trust and understanding, making sure we've got those informed consent processes. So we're clearly explaining the purpose, the scope, the potential implications of sharing that health information, make sure that individuals or their parents or guardians, for the minors, fully understand the nature of the information being shared, who's got access to it, how it's going to be used, and using those consent forms in really plain English that's really accessible and easy to understand. We want to have those safeguards in place around the data storage, encryption, access control, training on data protection, and audits to make sure compliance is occurring with those data standards and privacy standards. Collaboration agreements, data sharing protocols, outlining the purpose and scope and limitations of the data sharing as well, de-identifying and aggregating information when it's been used for research purposes or statistical purposes, so that it's reducing the potential for privacy to be breached. So we want to make sure that we're protecting that individual privacy, but also still giving us those insights into population health trends. And again, we've talked about professional training, capacity building around laws, ethics, best practices as well, and that continuous monitoring and evaluation too. So we can see that there's a variety of ways that we can have a look at our, overcoming some of these barriers between the sectors. And it's going to become increasingly important, I think. So it's very important for us to try and work out what are some ways around it. Let's start, making attempts towards that. And the way I like to look at it, because all of that information, that's a lot of information, is, okay, what is the one next thing, the one next action step that we need to take? It's really important to have a think about that, because otherwise we can be presented with information and go, yeah, that looks good. And then nothing comes of it because no one knows what is the next step. So it's really important to go, okay, what is the just one thing that we need to do that can reduce those barriers, that's going to make everything easier or unnecessary? To me, I can see that we can reduce people flooding into our health system when they get out of school, if we can promote positive health outcomes when they're at school. So if the state government wants to focus on health and wellness, let's integrate it into the curriculum. I think that's a really good start. So I look forward to joining you guys for more conversations on this topic. I would love us maybe next time to work out, okay, so we've identified some potential issues, we've identified some potential strategies. What is the next action step that we would need to take in this journey? I know we talked a couple of catch-ups ago about cross-sector collaboration. So I've started collaborating a lot more with people who are into health tech engineering or just engineering in general, the IT sectors, and various people who can influence the way that I think and the way that health professionals think, to help us to innovate in the health space. It's not okay for us to keep thinking, oh, this is the way life is. These are the stats that we've got for health outcomes for young people. We're doing our best. There's huge wait lists. There's huge costs. It's inaccessible to many in the population. Doctors are banging their heads against brick walls saying we can't get access to health services anymore for people on Medicare plans and things like that. So there are ways around it, and we just need to pause and have a rethink. We don't need to keep doing things the way we always have. I don't think it's working. There have been some beneficial things that have gone on, but there's a lot more we need to do, and we kind of need to stop and pause and reflect and talk about it together. And that's what the purpose of these meetings is. So I look forward to seeing you guys in 2 weeks online, and we can thrash this out a little bit more. Bye.